Good evening, ladies and gentlemen. This is Gerardo Poli.
And this, sorry. Okay.
I'm Gerardo Poli.
I'm Hubert Hemstra, and this is the Vet Vault.
Our guest for today's episode is a veterinary virtuoso, so much so it's so hard to pick one single job title for him. Dr. Adam Christman. He is a practicing small animal veterinarian in the same practice where he started his veterinary career as a 14-year-old kennel hand, as well as a veterinarian at a local animal shelter. But his veterinary journey has taken him on so many interesting paths, including completing a MBA, so it's a master's in business administration, public speaking, a career in media, social media influencer, published author, and Disney aficionado, and most recently to his new role as the veterinary director of DVM 360 and the Fetch conferences.
We start our conversation with Adam with an important topic that's very close to my heart, daschunds. But don't worry, the episode does not peak there as you might expect. We also cover a wide range of other topics, like Adam's secrets for when you're feeling stuck in your career, how to make sure you have a smooth relationship with one of the most precious resources in your practice, your nurses. We talk personality types, the brand that is you, maintaining energy levels, and much, much more. And did I mention the daschunds? Please enjoy one of the most fun episodes we've done so far, Dr. Adam Christman. Dr. Adam Christman, welcome to the Vet Vault podcast.
Thank you so much for having me on, guys.
It was so great to connect with you and see all the stuff that you're up to.
Yeah, it's been quite a rodeo the past few months, that's for sure, with COVID going on and new careers and all that stuff.
Yeah, absolutely. Now, I'm going to start with something. I can see you're at home. I'm going to say, if I showed you my sausage, will you show me yours?
Yes!
Here's a sausage I prepared earlier.
Oh my God. You can't, I didn't even know. I had no idea that you had a dachshund. Thank God I'm sitting down.
I was stalking you, and I saw we had one thing in common: is a love of deformed long dogs.
Right. I'm a dachshaholic. I really am.
Dachshaholic.
The dashies are in my second, okay, so it goes Chihuahuas, cattle dogs, dashies for biting for me.
Yeah, yeah. That's true. They think they're Great Danes or Doberman Pinschers. Big personalities, too.
Yeah, they're cute dogs. Especially the dapples with long hair. They're like so fluffy and soft.
Yes. I have two wire hairs. I got to bring them up and show you, but they're so cute. Oh, I remember when I was on my neurology rotation in vet school, and I just got so drawn to them on how strong their will was to walk if they were down and paralyzed, and just how sweet they were. So I remember saying, one day our paths are going to cross. Our paths are going to cross. And lo and behold, not one, not two, but four,
So you started with one who was handed over, the owner couldn't afford treatment or something.
Yes. So he was a down dog, Cosmo, long-haired dachshund, just like yours. And he was 2, and the owners couldn't afford a surgery because, as you know, IVDD is an expensive surgery to take care of MRI. So they couldn't afford it. So I ended up going and getting the surgery done for him, but it was too little too late because he had deep pain, loss of deep pain at the time. So, but no, I ended up getting a wheelchair for him, and, he lived another 12 years. 12 years I had him expressed his bladder. I wrote a book called Honey, Have You Squeezed the Dachshund? That's on Amazon.
I get the squeeze part. I thought you meant just like a cuddle squeeze, but now
I know. No, it's this squeeze. So squeezing the bladder like the football player hold versus toilet holds.
Wow.
I saw the book. So is
it a
that
bestseller?
Yeah, it's a New York Times bestseller.
Do you get any sort of judgment ever for having a purebred sort of a dog, and then especially one that has a genetic predisposition to problems? As a vet, do you ever find? I certainly, when we got this one, I had a few of my colleagues and people go, "You can't get dachshunds. back's going to go. Yes, you should know better as a vet. Did you get any of that?
Right. I love that you asked me that because, yeah, I get asked that multiple times. And one is like, do you know what you're signed up for, basically, when you have the long back dogs? And I said, yeah, my wallet and credit card's prepared. So,
Yeah.
but, and then when you ask about the purebred dogs, like, why can't veterinarians get nice purebred dogs too? I mean, we understand the breed standards. I research them heavily. Like, I really know dachshunds, and so I go to the creme de la creme. The one dachshund flew in from Belgium, the other one flew in from Canada. So like I got like, I did my research. The other two, I work at the animal shelter. So the smooth ones, the ones that had back issues, are the ones that came from the shelter. But regardless, it is what it is. You just never know. It's a crapshoot of whether, their backs are going to go. And listen, my house is full of ramps everywhere, and I do everything I can, but yeah, you just don't know.
There's ramps everywhere. That's hilarious.
I got to show you. I'll show you when we're done. You're going to crack up. It's the funniest thing when they go outside in the backyard.
It's like
they go down. Is there a particular ramp that you endorse? Like, yeah, so I endorse a homemade one. I built it. So, and it's built right into my stairs. So I was going to design a pulley because I have a 2-story house. So like they could walk out and hit their paw and a lever goes up.
Oh, there's a product there. If you can engineer that in some kind of like, safe way,
Yes. I'm telling you. I know, I could be onto something. They just hit their paw and then just walk out. Do.
I can see that we might end up going down a rabbit hole here, just having a whole podcast about that. It's a bit like if a vet ever confesses to having a bulldog or a French bulldog or something like that.
Yeah.
Right. Do you feel like, do we have a responsibility or a role to play there, or as veterinarians, is it our business? Should we interfere?
Yeah, I think it's good I think it's nice that veterinarians know breed predispositions, I always say this, my clients don't look me up on where I went to vet school in my bio. The first thing they look at is the picture of me with my dachshunds. And they're like, boom, I'm going to this guy, and it becomes this cult that like, yes, the basset hounds come to me, the corgis come to me because I understand and get like the low riding dogs and back dogs and so forth. I work with a veterinarian that has an English bulldog, and she is inundated with French bulldogs and English bulldogs. So, I mean, life is all about like, it's like vet working, like networking and relationship building. And if you get the breed, I would want to go to a veterinarian that really understands the dachshund breed, or I do a lot of shelter medicine work. So I do a lot of rescues too. So I get that clientele that comes to me. So I think it is our responsibility to know all the breeds, but like, have a little bit of like a specialty in that area,
Yeah, like a special interest, you understand. It's a common ground, right?
Yes, absolutely. Like I'm not that familiar with Great Danes and Doberman Pinschers, but one of my colleagues has a Doberman Pinscher and is very familiar with the wobbler's condition that they can get in their cervical region. So it's just nice that I can just bounce something off of a friend, be like, hey, I know you have them more. What do you think should we do? Should we go for surgery and do a ventral slot, or should we go for the beads and gold bead implants? So there's like, it's just nice to have these veterinarians around that just kind of get the breed a little bit better,
Yeah, totally. I use that so one of the key things I use in consultations is my affiliation and love of working breeds. So like, especially the pointy ones like Kelpies and Border Collies, it's common ground. It's like, oh, I've had 2 of these guys all the way through to 13, and all of us, like, that's a level of connection that I always try to find some kind of common ground with the client in the consult room, and help it builds trust and cred.
Yes.
And not in an inauthentic way. I'm never going to say that, hey, look, I have a Great Dane and I know exactly what you're talking about. That's lying. But if you have common ground in there, then I think it's worthwhile leveraging.
Yeah, I agree completely. And by the way, Australian cattle dogs are so popular here in the States.
They're really nippy bastards. Holy shit.
They just love herding their owners to bed every night,
That's a good question. Are they bitey and snappy there as well?
I don't. Well, what they're known to be is the gifted and talented of the dog breeds. Believe it or not, like they know like their commands so quickly. Meanwhile, dachshund's like, what? You wanted me to sit? Nah, that ain't happening. But or Australian cat, I was like, okay, stay down. What's next? What do you want me to do? Where are we going? Who do you need? Where do I need to be? You know?
Yeah, cattle dogs. I don't know. Like they're one of the ones where they're so good. Like I learned so much from watching cattle dogs because they're like ninjas. They're like ninja biters. They're just like they don't move, and then bam, they'll get you, and you're like, holy shit, where'd that come from?
Right.
Yeah, right. And it's the eye. I think
I was about to say it's the sideways glance.
It's the sideways eye.
That's so
It's like
funny.
whenever a cattle is looking sideways, I'm like, okay, I know what's coming. You're just waiting.
It's on.
Yeah. But
Right.
Adam, like I've been following you on Instagram for a while, and also like on YouTube as well. But like you're involved in so much. You got like you got like what close to 40,000 followers on Instagram, and there's like almost 9,000 followers on YouTube, and then you're involved in like Fetch DVM. Like what is your role in? What do you see yourself as? Yeah.
I like to always say, like, what's amazing about the veterinary career is how well we all evolve and just trying our new passions as we develop into this incredible career. And I've turned into a social media personality, essentially, and I love it in different platforms for both pet parents and for colleagues and the community, the veterinary community. And it literally evolved into that. I started taking videos of dogs that needed homes when I was doing some shelter medicine, and it turned into, can you give us some instructional videos on how to clean your dog's ears and how to trim their dog's nails, how to brush my dog's teeth? And that turned into the radio station stuff, which turned into like me doing some national speaking on the veterinary. So it just kind of like unraveled. And then I love all these different platforms where I do like the educational video. I feel like you just get a better connection through a video than you can through a written instructions. And I found that when I was practicing too, that, people are not as good in terms of hearing things in the exam room or even seeing things. So what I would do is just follow up with a quick little video that I would send to the owners too. Let me just show you, this is how you're going to pill your dog. We under assume what these pet parents can do, right? I'll put the eardrops in. Well, what do you mean? Like, what do you mean? So, and then I would do a video. Let me show you. This is the dog's ear canal. It's going to. So all these videos just turned into this content that I just started to create and follow. And now with these veterinary students that you guys know, like on Instagram, that our next generations of veterinarians are incredible that are coming through. Our profession is going to be even 10 times better than where it's at. But so I connect with all different platforms.
So it wasn't a master plan. You didn't have this vision for yourself that that's what I want to end up. But it was more of an organic thing by the sounds of it.
Yeah, it was very organic. It was people telling me that I'm not surrounded by yes people. I'm surrounded by some people like, no, you don't have this or don't do this, or whatever. But it ended up being where people were saying, you really should have your own show. Like you have, a good relatability. And because of my platform, my personality tends to be a little bit bigger than that in the exam room. So I think that having these kinds of platforms allows me to be happy and passionate at the same time.
So it's one of the main drivers in terms of like human drives, and what makes us happy is actually the drive for creativity and then the drive for self-expression. If you have the ability to have a project where you can just like have creative expression and creative control, it almost just like that's what becomes your passion somewhat. Passion comes and waxes and wanes, right? But if you're able to find that thing where you're able to have creative control, right? Like Hubert thinks that he has creative control over the podcast, but, but I totally understand what, like where this all goes. So I'm kind of slowly just, notching him into the direction that I want him to head in. I have to make it feel like he has creative control, right? But downplaying Hubert, but like, is it this creative control that's kind of coming out that you're like, yeah, I love this. This is awesome.
Absolutely. And having the ability of assuming this newer position working in veterinary multimedia, and they literally are just saying, go for it. We know what you're capable of doing. We're just going to support you along the way. And I said, like, I think we should have a talk show. I really want to bridge the veterinary students onto the DVM 360 platform. I want to have more virtual webinars. They're like, go for it. We're going to support you because we know you have what your creativity is there. This is what we got hired for, to be a change agent and to embrace your creativity. And that's what I love about it, because sometimes I love private practice, but sometimes I felt like I was almost in that box of a room. I felt a little boxed in terms of my headspace. So, and you guys can appreciate, you know what I mean? Like there's that moment every now and then you just feel like, you know, how many more times can I talk about like anal gland expressions and Cushing's disease and diabetes? And it's so important, don't get me wrong. But for some of us that are creative and want to explore different avenues, I felt like this was probably the next chapter that was needed in my career.
Yeah, that really resonates. And what you said as well, Gerardo. I think probably the majority of vets, again, because you have to do well academically to get into vet school, and generally speaking, academic people also have other interests in high school. And so I think most of us have a creative streak as well. Majority of vets would have done some sort of art or music, and then you hit vet school, boom, and it's just study, and that's out the window. And then you hit your first job, and it's just work, sleep, and a part of you almost dies for a couple of years there.
Yeah.
Well, it's like creative expression also involves self-mastery, right? So universities around mastery, right? And then your core focus for 2 to 3 years is mastery of general practice, mastery of this. 2 years, 3 years general practice, you've mastered 95% of the things. And unless you create some other kind of avenue, some kind of side hustle, some kind of like, I don't know, next level, whatever it may be, right? You get disillusioned because where is there?
Yes.
2 or 3 years.
Yes. That's exactly what it feels like. And it's not to say like there's a difference between that and versus feeling burnt out. And and I don't think it's like a burnout feeling. It's more of like, I think you're going to vet school and you're studying your ass off. You're working so hard to learn the science and medicine. You go into practice, you know your limitations. You know, like maybe I can't do a total hip replacement. I know somebody who can, you know, right? So like, you know, those conversations, you master the art of the conversation in the exam room. You know, you set expectations for yourself. But then there's a part of you that feels like, am I becoming a Stepford veterinarian? Like I feel like a robotic performance that I'm providing. And so, you know, you want to be a little bit more creative like you guys do in a podcast like this. This is amazing where you can express your personality and yourselves a little bit beyond the exam room.
Hubert's a puppet.
Yeah.
I'm going to edit all sorts of shit into the next episode with you.
I'm just
for payback.
I'm just teasing.
I love that we're talking about this though, because it's something that not many really do talk about, because everyone's focused on, you know, veterinary school and practicing, whether it be large or small animal surgery. But I hear this from veterinarians, my veterinarians, I hear this, I'm stuck. I feel like I have nowhere else to go. I think I'm supposed to own a practice, I guess. Is this my next step? You know? No, it's not.
That's your formula. It's all the formula. It's the only formula you hear.
Yes.
Be a vet, be a good vet, be a GP vet, specialize as a vet, or buy a practice as a vet. There's like only 2 pathways, right?
Yes.
Industry, like unfortunately, like I don't know what it's like in the US, but if you go into industry, all of a sudden you've failed as a vet, you know, and that's so not true, completely not true, right? Yep. And there's so much knowledge that we have. You just got to think outside the box.
Yes, absolutely. There's so many opportunities out there. See what I did there?
That was really bad.
It's my New York accent, my opportunities.
So we were going down this pathway of your multiple roles and you're a Swiss Army knife. But okay, Fetch, give us a rundown on Fetch. You are the Chief Veterinary Officer. What does that mean?
I don't know. It sounded important. So I was like, this sounds good. I guess talk about like changing things up. But so this is a multimedia company. So have you guys heard of DVM 360? Have you heard of them?
Yep. Yeah.
So I oversee all their content, both in print as well as online. And then We have webinars too. So I invite you guys. We guys got to do something. We have to do something.
I can do a dance. It's really good.
Yeah, something. I don't even care. I really don't even care. Like we could do a Magic Mike performance. I don't care. But then, have you heard of the Fetch conferences? I don't know if they're not out in Australia, but like, so there's Fetch conferences around the country in the United States.
Yeah.
So there's 5. We're putting in a new one that's going to be, well, willing COVID, but in Indianapolis. So, but yeah, Indianapolis, Kansas City, Baltimore, Atlantic City, New Jersey, and then San Diego, California. So,
and is part of your role organizing that, or do you oversee the content, or what's your job?
Let me tell you something. Let me tell you something. You want to talk about organizing your brain differently? Like us veterinarians, we're used to just like going into an exam room, assessing a problem. Here are the antibiotics, and then the nurses can do the rest. But me, like, this is like my life now. So these are the conferences. So these are people that have like canceled because of COVID, and they can't do certain times. And so like I have to shimmy them around different schedules and everything. So, and then you need to have like race approval. So all your continuing education, you have to have X amount of credits. So like you need endocrinology and you need internal medicine, and then you need to have the technicians and the practice managers to have their credits. So it's all, but it's cool. It is like problem solving and plug and play to see where everybody needs to go. But it's interesting to see. You get to see the best and the worst of veterinarians because they're like, no, it's too early for me.
Are you still practicing clinical practice as well, Adam?
I am, yes. On the weekends, I'll practice and fill in at the practice that I was at. I was there since I was 14 at that practice. And then I also do shelter medicine work. I know, right? Like
14.
Hang on, backtrack. You were there since you were 14. Doing what?
Little 14. I was cleaning out the kennels when I was. So my practice was right across the street from my high school. And so after school, look how driven I was back then.
Wait. And you're not driven now. You just take it on. Have you ever done a personality test? I take that you'd be.
I have. Yes. I know my letters. Do you know your letters?
Oh, no. Share.
Oh, you should do the Myers-Briggs personality test.
I've never done that one. It's so complicated.
It is complicated.
I'm sure you guys are extroverted, right? I think you're extroverted. Would you think you're extroverted?
Hubert is just a total lovable, want to please everyone kind of dude.
Yeah, but I'm not an extrovert.
Yeah, you're more introvert. They say like 79% of veterinarians are introverted. Like it's very high.
Yeah, I could put it on, and I think veterinary science has been really good for that. Clinical veterinary science is practicing the art of acting like an extrovert or speaking to people and making connections. That you just have to learn to do it because you have no choice. But no, I think lots of people will feel like me. It was very hard work for me. Consulting is still very hard work for me. I can do it really well, but at the end of the day, I am spent emotionally.
Yeah. And that's the same for me. Like I am a driver, and if I could do something in 7 words, I'll do it in 7 words rather than 70 words. But then I realized, you know what? I realized that I couldn't be the person I really naturally am, because it would never work, because I worked in libraries as a librarian. Like I learned a skill there, and that was just connecting with people. And it took me out of my kind of like, tell me what you want right now, to like, tell me, and I'm engaged and listen. And it's helped me in consults ever since.
Wow.
To actually bring something on that is not innate my natural personality.
Mm-hmm. And that's a skill that's not easy to acquire, to do like active listening and to engage and listen to what their wants and needs are. So yeah, kudos to you guys, because that's not easy.
You actually won an award called the Excellence in Bedside Manner Award. So does this come naturally to you?
I think because I was a technician for many years, and before I went to vet school, and while I was going in school, I think, you guys know how it is. Like, I think great veterinarians are great technicians too. And so I think I've always had that compassion. I always was. I'm very, very emotional with animals too. And I connect with pet owners. When they're going and grieving, I feel it. I will tear up. I get there. I understand. I have this incredible, I guess it's a blessing and a curse of empathy and sympathy, because this is where you can wear out at the end of the day when you're doing a 13-hour day and you're having these highs and lows, because I feel, like I really feel what they're going through. And so it's hard just to turn that off and see that new puppy exam. But yeah, just the power of empathy and understanding was always something that I was always taught, just to be kind to one another and be respectful. And I think that's what makes you a successful veterinarian. It's not like how much you know, it's just the ability to connect and understand and listen.
Dude, love it. I pipe in. I've shared this story numerous times. So when I started an emergency, all I wanted to do was just be a good emergency clinician. So then when I then became a partner, I was like, I just want to make the best emergency clinicians ever. What I need to do, I need to teach them the shit that they need to know to be awesome emergency clinicians. So we focused purely on just like clinical skills. And then, to be honest, I saw vet after vet pass our accelerated emergency program and then come out the other end and just like still not just quite hit it. And it's like, what is the difference? It's not experience. We have vets who have been out 1 year that are much better able to connect, much able to, advocate for the pet than a vet who graduated with me. Right. And you know what it is? It's not clinical knowledge. And some people strive for that, thinking that clinical knowledge will make them stronger, better, more confident. There's a growth. There's a growth of clinical knowledge with like ability to connect and performance skills that now it's clear for me. I don't care if anyone thinks that I'm wrong. I'm 100% certain in what I think, and that clinical knowledge will only get you so far. You have to invest in your own personal development. You have to invest in your,
Amen to that. It's so true. I say that all the time. You train the brain, but like you hire the personality, because you can work on the skill set all that time. But it's just if they have that personality, or we have people that get interviewed like, oh, I hate people. Like I don't want to. I love animals. I hate them. I was like, well, this isn't for you.
That would be like, it's awesome. Like, I'd love to run a fetch DVM webinar. It's like, there are 10 things not to say in an interview. I'll tell you right now.
Let's do it. That's what we should do. I'm telling you, because that's what people want to know more. I mean, listen, we can Google and look up how the glomerulus and the nephron friggin' work. Like that shit. Okay, fine. But it's this stuff. This is what people really want to learn and know and develop, because it's everybody wants to feel like they're a VIP, a very important pet parent or patient.
Totally. And I am almost, to be honest, going to the like I've almost been sold on the performance skills are somewhat almost more important than clinical skills. Okay. Yeah. And that is a controversial kind of thing, but I've seen it time and time again over dozens and dozens of vets, that ability to connect, ability to relate, ability to manage your own time, ability to self-care, that is going to take you so much further and longer and further than your clinical know-how. You can read a textbook, you can call someone up for advice, but if you can connect with the client and then communicate in a way that they trust and engage with you, that you're going to be so much better than someone who's like, you know what I know because I'm a doctor. And
right.
So you spent years working as a tech, so that's equivalent to our nurse position here. Did you learn special skills there, how to relate to your techs or work with them and get the most out of them? I remember one of our very first episodes, our guest actually said, when we asked her what's the one thing that she would tell other vets, her one thing was be nice to your nurses. Have you got any tips or tricks or advice for young vets as to how to relate to your techs or your nurses better?
Yeah, the best thing is to listen to them and utilize them to their greatest potential, because you both will succeed in and out of the exam room. And I've seen this over and over again, where I've had new graduates that have not utilized their technicians, and therefore the technicians that felt that they were not valued, not important, not part of the treatment plan or the process. And so they would screw you and blackball you because they're like, you're not going to let me set catheters or like go over your discharge instructions. Screw you, because I'll work with the other doctor who will allow me to do that. So I've learned more. I say this to all my new graduates. I have learned more when I came out of vet school. I learned more from my vet techs than I did from vet school. because right, they show you the practicality of like, this is how you do like your blood gases. Let me show, because you're afraid to ask maybe in vet school. And I'm like, wait, is it the red top or purple top tube that I use?
I still ask that question. It's like,
and
it's like, okay, what is the difference between purple and green and whatever?
Right. Like, how do I do anaerobic transfer? Like, what? How do I take it out into a plain white top tube? Like, what's a citrate blue tube?
I'm always embarrassed to admit this. If I get a new vet and they ask me about using any equipment in the hospital, and I mean, pretty much anything other than the ultrasound machine, I'm like, I don't know. Just ask one of the nurses, mate. It's my business, but I can't tell you how anything works.
I have to say, they ask me, how do you troubleshoot this machine? I'm like,
That's a good question.
That's a good question. You know what? The value that I have, the value is I will connect you to the right person.
That's right. That's what I say. I'm your Oprah Winfrey for networking.
There's a tricky dynamic that I often see, and I think it's more with female vets, young female vets, and they come into a practice and they have to work with nurses who've been there 10 years and who know their stuff, and they can often be a little bit of headbutting and a little bit of trying to establish them. I often get the impression that the vets are trying to establish themselves as an authority, which they are. They do need to become the team leader, but then they butt heads with the senior nurse who's like, you're going to have to prove yourself to me. Did you say no? Have you never seen that?
No, I've seen that, but I think that's totally okay. You're asking Adam the question, and I will shut up.
No, I think it's absolutely spot on with what you're talking about, because it could be a mean girls club. It could be mean girls, these practices too. These veterinarians, like you said, they come out, they try to flaunt their feathers and show off like, okay, I'm the doctor, I know what I'm doing. But if they can turn on a dental machine or turn on an X-ray machine, and you have a girl that's been a licensed technician for 20 years, she's going to be putting that girl right in her place and be like, you know what? You don't know what the hell you're doing. And so I don't care how many initials you have after your last name or credentials. Like, if you can't turn on a friggin' X-ray machine, I have no respect for you. So yeah, there's like a little bit of that powwow or power trip. I think that's present. I do find it, this not to be sexist, I do find it harder for the women than the men to prove their worth for some reason, for whatever reason it is.
It's the act of deference. The act of deference.
Yeah, gotcha.
You know, like what do you have to prove? You know, like, how about you defer to what they have to say? Hey, how do you think I should manage this? Oh, I think you should manage this way. That's really cool. Actually, I'll try that. Yeah. There's no, how would you say, lack of value. There's only value in asking someone what they think first, because then you might learn something, right, to improve yourself. It's like, oh, actually, that's a really good idea. But I was, actually, what I might try is this and see how this goes. You can always change. You can always change your way. But like, if you are a new grad going into a practice, then don't go in there with your like, hey, this is my textbook, this is my professor said, and this is how the best thing is. It's like, hey, I'm like, what do you think? This is my situation. This is what I'm thinking based on this. But what are you thinking? Like deference. I think it's a primary rule of just building trust and rapport.
Yeah, even if you do know the answer, still ask. Because it shows them that you respect their opinion.
And there's a fear of change that happens in a veterinary hospital with the support staff when they have a new doctor that comes on that would say like, well, this is how I like to do whatever. My euthanasias, let's just say I have a protocol that I like. And they will say, well, no, that's not how we do it here. And that's not okay. That's not okay to say something like that. It's collaboration to understand. You might want to try it this way. We find that it works this way versus your way. But yeah, I'll be more than happy to try it that way. You just have to have that ability to adapt with change that happens. And, that I see that happen because I've gone into multiple practices like you guys, and I see how the cultures are different. And some of the cultures that are toxic are the ones that fail to adapt to change.
Or don't respect the knowledge and the experience that the rest of the team has and what they can bring to the team. And like, it was one of the biggest things, it was my biggest burdens, was being or having to know everything and having to be the pinnacle of the knowledge within the practice being the director or being the person who created clinical training programs, and them feeling threatened by someone coming and saying, actually, they've changed that now. They don't do that anymore. And it's like, whoa, you're like, who are you to say that to me? Right. And then like, I realized that there was such a burden and I was so closed off that it was like, this doesn't help anyone, doesn't help me, doesn't help them. Why wouldn't we all want to just improve and collaborate? And when I let that go, it was just the biggest freedom that I've ever experienced. Yeah. And allowing people to contribute to you was just bush. I don't know.
I love this. We were talking about this earlier too, about, the new graduates mentality. What are some of the things that I was on Instagram Live with a vet student, and she said to me, what's some things that you would give me advice on when I come out of vet school? And I said, don't be afraid you're not going to know everything. You're not going to know everything. So, and that's cool. That's awesome. And no one knows everything. I still don't know everything. It's something called continuing education, but being able to utilize your team and learn from them is most important. So stay humble, stay true to yourself, and, build your brand. You can build your brand within the practice, but you're not going to know everything. So.
Oh, I love this. Okay. Hubert was going to talk about your childhood memories, mate. But I was like,
oh no, it's like therapy session.
And why you're drinking right now, like Gaviscon. Okay, so protein powder, is that part of your muscly secret, right? Okay, 2 grams per kilo per day. But no, you're talking about brand, like, and okay, this is something that really clicked with me. If you are. I believe that if you are in a primary practice, you have to consider yourself more than just a veterinarian. You should consider yourself as a business, or you should consider yourself as a professional service, or as you said it, as a brand, right? Mm-hmm. Once you view yourself that way, it shifts. How can I make my brand better? What do I need to do to level up to provide a better service? How can I then make my customers and my clients feel like as if when they experience my brand, the brand is better and they have an exceptional 9 out of 10 experience. Like, rather than being threatened by feedback, by negative complaints or whatever it may be, it's almost like, hey, if I wanted to make my brand the best, I would embrace feedback.
Yeah, that is impressive. I tell everybody too, like some practices that work for a corporation, a consolidated firm, they feel like they can't build their brand. I said, yes, you can. You can build your own individual brand within a practice too. People come to me because I'm the dachshund guy, and that's my thing. I do these social media videos of how to like trim your dog's nails, and people love that stuff. There's another veterinarian and she does stuff on ultrasounds, and they love to see what she's doing with that whole content. So it's just about like, the brand, just building your brand and understanding each other.
I love what you're saying.
Yes.
Like people come to people, right? Right. People come to people they trust. They don't come to a brand. I don't know. They don't come to a whatever kind of like blue pill brand, right. Like they will come to the person they trust and know. So that people need to appreciate that they're more than just like a person, and they're more than just a vet. They are a professional. They are a professional. I don't know how else to say it. It's you got to consider yourself a brand, and what kind of brand do you want to display? What do you stand for, and so forth? How do you want to interact? What do you want your clients want to feel after they've had an experience with you? Like, know what these things are, because then that will change the way that you will interact and the way that you communicate and what you how you react. So
yeah. Adam, are you still involved with the shelter medicine that you do? Is that the stuff you do on weekends, if you're working? Yeah. Is it a local dog shelter, or what's the scenario? What's the setup where you work?
So it's local. It's called Animal Welfare Association, and it's a high volume spay neuter clinic / vaccine clinic and / wellness. And it's interesting because it annoys me, and I love it. I love it in the sense that, you're doing like good, shelter medicine work. But then you get these pet owners, I don't know if you have these by you, but there's vaccine clinics. So like low cost vaccine clinics. So they come in, this is before COVID. So like, it would just be like a cattle of people. Like we would do like 150, 200 animals, in a day of just like vaccinarian, just poking, but people would complain about the wait time. And I actually spoke up and said something, right? Now, mind you, they're like $20 for a vaccine or something.
Yeah.
But they're complaining that they're waiting. I said, the amount of time that you just waited for your designer breed dog that you just got, you could have had a nice $70, $50, whatever it is, consultation with your veterinarian to be educated about vaccine, preventive medicine, flea and tick, heartworm, all that stuff, because you're trying to bypass the office visit because you don't think there's value associated to that. But yet you're going to come and spend your hour on a weekend to get a $20 or low-cost rabies vaccine and call it a day. Like, that's not okay with me, is what I keep saying.
What was the feedback? What did they say when you told them that?
Right. They feel that they know enough medicine because they look online and they know what their dog needs. So then they'll come in with that, certificate or the sheet, 3 years overdue on a December vaccine, never finished up a series on a leptospirosis vaccine, and they think that that's okay, and it's not. And so, like, I said to myself, why am I not to waste my time, because I got to keep it going. But I said, these are just multiple examples. So they really do understand. By educating them, some of them left and just went to their own veterinarian to make the appointment. I mean, some of them would come in with horrific skin infections, ear infections, and they're here just for the rabies vaccine, or did you get the nails trimmed? But there's some underlying problems that are really serious that need to be addressed to their veterinarian. So I just felt like, as a veterinarian, it was my due diligence to let them know you need to be educated properly, and not from Dr. Google, from the veterinarian about this information.
So if you say shelter medicine, define shelter medicine. So these are not street dogs and rescue dogs. They actually owned by people. So who qualifies to come and get these cheap vaccinations?
You can have people that drive up in a Porsche that come in, and I'm not kidding, like they literally will come up in a Rolls Royce or a Porsche and do that. There's no clear definition that defines like who comes in for this low cost vaccine clinic. So there's that component. But in terms of the shelter, yeah, we get animals that are from all over the country that get shipped all over. They work with the ASPCA. So, dogs and cats and rabbits and all the different stuff. So we do, medicine and treatment options and all that stuff, which is fine. But then there's that part. And then we also open up the low-cost spay and neuter clinic to the public.
That's a bit strange.
Oh, yeah. And so, if people can't afford, their spay and neuter from another veterinary hospital, they'll come over here for low cost to do it. But, there's some trade-offs with it, like there's no preoperative blood work that's done. There is no, I don't have another nurse that's on the dog 24/7 that's watching them for recovery. It's just an assembly line, go, kind of a thing. So
would it be better to have the same price, but then help them pay it off, as opposed to having it cheap?
Absolutely.
Well, who runs it? Is it run by private companies, or is it like a government run thing? Or
it's government run. It's government run, but it's not very it pisses off some of the veterinarians around that.
I can imagine.
Right? I mean, it would totally piss them off. It pisses me off that I even do it sometimes, but I do it because I do a walkthrough with the animals of the animals that are in the shelter, those that need care, vomiting, diarrhea, skin cases and stuff. So you deal with that, and then you deal with that component with the public. So unfortunately, it's part of their moneymaker too. They make money that way to keep the shelter sustained. Okay. But it's a different model, And I talk about this in one of our conferences, you charge, maybe $200 to $300 or whatever it is, cheaper than my spay. What's your model that's different, and how do you, educate the pet owners that yet at the same outcome is going to be a spay, but one's much higher than the other,
Yeah.
Okay. Yeah. Now I'm confused. Okay. We can edit this out later, Hubert. I just don't get it. Okay. What is shelter medicine? My thought was that shelter medicine is like what we have in Australia, which is the RSPCA. Like, Royal Society for the Protection and Care of Animals, which is like, okay, you can't take care of your pet. You drop it off to us, but you don't get the pet back. We will take care of the pet, right? Or we have some subsidized, not subsidized, okay, but they are some welfare organization vet clinics which are subsidized by private funding and fundraisers, and they offer reduced, maybe not even reduced cost, but like actually they offer more lenient payment systems. What does shelter medicine mean?
It is similar to that, by the way. So there are shelters that are just shelter medicine only. So, you know, I'm giving up my dog, you guys take care of it, or we found a stray dog, you guys take care of it, kind of a thing. Absolutely. So we have that. Cats, they're ridden all over the country. We have all of those. So, and there's veterinarians that do oversee that and will do the spaying and neutering and the medicine component too. So, you know, they get hired to do it. It does have a very high turnover rate, unfortunately, for veterinarians because they get burned out from just constantly spaying and neutering nonstop. Like it's a lot. So yeah, there's that. But then there are other models, business models in this country that have the shelters that are working with the communities to help those pet owners that have financial constraints to do some of the preventative medicine components. So such as vaccinations, heartworm testing, and then spaying or the elective procedures, so spaying and neutering. So if they can't, if they can't afford it from their veterinarian, the primary veterinarian, they can go to the shelter veterinarian to have it done. And so there's a waiting list for that too, because, you know, here we have the shelter veterinarians that are taking care of all their internal animals, but then there's also a few that need to get spayed and neutered, you know, for pet-owned animals.
Okay.
So
you said there a second ago that there's a high turnover of staff, of veterinary staff, because of the pressure it can be a really emotional and a really tough job. Why do you do it? I don't want to say what's in it for you. What motivates you to do it?
It's not the money, obviously. It's not the money. There's a sense that like you're making a little bit of a dent in society. I guess to me, it's like self-worth. I feel like I did something good. You know, like I can put my head on the pillow knowing like, yeah, I vaccinated 200 animals against like rabies today. Like that feels good. And whether it be client-owned or shelter animals, or like I did a video of a dog that needs a home today. So I do that, all those to make sure that it's a feel-good feeling. I guess from veterinarians, we're veterinarians because it's a calling from here, not so much from here, you know, so it's more from our heart. And so when I do those things, it kind of reemphasizes of why I love what I do for a living, you know, and maybe if there's a dachshund there, maybe I'll take one.
I knew you had ulterior motives. You're looking for those dachshunds.
It's like window shopping. You're like, ooh.
Hey, Adam, before we talked about COVID, and in Australia, we've been pretty successful in actually reducing the actual spread. We've had 7,000 cases, and quite often our states have 0 new cases per year. But like the question is always brought up, like how can our students access continuing professional development? Like where can they go? What do you guys what can Fetch offer the students that can't go to universities, they can't really go to the pracs that they really need to, and things like that? Is there things that you guys can offer?
Absolutely. And we're very adaptable. And again, we're learning as we're growing. These are growing pains in times of COVID because we just don't know when we're going to see, you know, this getting better. So in the short term, we've developed an incredible, you know, webinar series, and an on-demand continuing education platform, which is on DVM 360. Believe it or not, it got launched today, you guys. So great timing.
Great timing.
Great timing. So they can get there's 10 CE credits they can get on right then and there, and they can go at their own convenience, which is nice. So, you know, if they're happy to be working and they're essential, thank you for everything that they're doing, of course, and they want to learn, absolutely go online. We are still plowing ahead with these Fetch conferences. It's business as usual. We're following the CDC guidelines, of course, if there's anything changes, but our next Fetch conference is going to be in Baltimore. And then Kansas City is in August. So, you know, I like to go to these conferences, not only just for the CE, but just like we were talking about earlier, you guys, just interaction and networking and talking to other people. I think we're gonna be missing that ability to talk and connect more so than ever. I know we're doing it virtually, but it'd be nice in person. So there's plenty of opportunities that we work on just so that everyone can get their CE on. And we're doing some live events virtually, which is nice. So we get some audience participation. I just did one last Thursday night where we did talking about telemedicine in veterinary medicine. And we had over 600 attendees that were engaging and chatting online and seeing what we had a panel of discussions of veterinarians that were on. And it was great. So, we really try to get everybody engaged and interacted. Plus, you can get your continuing education on at the same time.
How do you host that? On what platform do you host 600 veterinarians who can all chat to you?
So it's they have to send their chats through an email. So it's like just like kind of like how Zoom is, just like this. Okay, so you organize it and you look over to the right. You say like, oh, I see that Gerardo from Australia has a question.
Oh, I'm here. Whoa, hello.
What?
It's interesting times for continuing education, isn't it? And again, like Gerardo mentioned earlier, with technology developing and innovation, especially in the time of pressure, I love the stuff that's coming out and more stuff available online and people finding interesting and engaging ways to present it. It looks like you guys are at the fore of that. I do still love a good conference, though. I will say I like doing my little stuff by myself, but for the reasons that you mentioned, I met Gerardo at a conference. I've said to you earlier, where you learn a lot, but then it's the social events in between.
Changed his life.
Right.
Tell everyone how much it changed your life, Hubert.
You're like the Apoquel that came out. It's life changing.
Hubert changed my life, actually.
You guys are good. I got to tell you, like your podcasts are very engaging and interacting. Like I have it all the time. Look at you guys on my podcast right now.
It looks like we're holding hands on that thing, isn't it?
I love it. It's so cute.
Yes, it is. It is.
Adam, we probably have to start wrapping up, but I do want to ask you, how the hell do you have the energy to do everything you do? It sounds like when you're practicing, you've got energy. I found a quote of yours. I love this one. Being a veterinarian is truly a performance. You have to deliver a great performance to your clients and fellow team members consistently. I love that, but that takes energy. We said earlier at the end of a consulting session, I'm done, but you're doing that, and then you've got your channels, and I can see you obviously exercise. That's on your social media. How do you do it?
I know it's all about like work-life balance. It's important to me, and I being self-care is not selfish, and when it's my time, and everyone knows that. And what I like is people respect it. I've known that. See, I'm obsessed with Disney because I did my master's work on the Disney customer service model. Like, I really am big on like how they function, the why behind it. I did all the analytical stuff behind it. Like, I know how they function. And so the reason why I say that is because it is a performance being a veterinarian, similar to how Disney is. It's like you're on stage. You open up that exam room door and boom, you are on. And so, you can have these highs and lows. No one cares about the euthanasia that you just did beforehand, but that's the cutest Maltese puppy that you ever saw, right? And that does take exhausting energy. It does. It's mentally, your back hurts, you're on your feet all day, all these different positions you're in from holding animals. And so, making sure you stay true to who you are is so important. Stay true. And working out is my jam. I'm a morning person. So, I do 1 to 2 hours worth of working out. I stay in the zone. I love TV shows. I love to stay connected. Like, I may not know veterinary medicine, but I could tell you which celebrity broke up with who because I'm obsessed with pop culture. But listen, I've been through a lot of shit in my life. I lost my mom and dad just several weeks apart from one another, and they were my best friends. I lost them last year, and my whole life changed from losing them. And I don't have any kids. It's just it was very scary, and I went to a very dark place. And I wholeheartedly mean that because I recognize when there's moments in my life when I'm like, I'm not in a good headspace, and I need to do something about it. I don't have a pity party. I don't go to the drugs or any of that stuff. I know that I need to do it, and so I rise above it. And I think just having those abilities of coping great friends and family around that can support you during times of low, and that can elevate you, really get you through those days. So, and that's my advice to everybody, because listen, everyone's got their shit. Everyone has shit. You know, it's just how you rise above that shit is what makes you a better person.
Yeah.
I don't know, mate. You just opened a whole can of worms. We were wrapping up, and all of a sudden, you like spread some bloody golden wisdom. Where it's like, oh, I have like 3 questions out of that, and now I've lost all 3 questions.
We got to do a season.
It's a season. We're gonna get Adam back for like the stuff he just dumped at the end of the podcast.
I know. I'm the same. I'm like, whoa, stop, go back.
No. Let's wrap up. Let's leave it as a cliffhanger. This is a cliffhanger.
Okay.
Yeah.
I'm going to ask you one practical question.
Yes.
Sorry, Gerard, I always do this, but I need to know this for personal reasons. So you're into your exercise. Are you guys allowed to go to the gym? No.
No.
So what are you doing? If you want to do what give me 1 or 2 of your favorite exercises at the moment.
Well, look, like right here, I could just hold when I'm like talking to clients. I'm holding my knees up to my chest. Look, hold my knees up. Right there. Look at that.
Okay.
So you can easily do that. Or like I have a kettlebell too. So like overhead tricep extensions, but I do at home workouts all the time.
Okay.
So body weight exercises are easy to do, you know, but there's something to be said. I'm such a social person, and when I go to the gym, it's like I work out with the group training, so not having that really hurts. But again, I make the best of it. So at-home exercises, you know, I use paper plates. Do you ever use paper plates?
What do you know? What do you mean?
Okay. Wait. Do you use like 10,000 paper plates?
Yeah, right. So put them on your feet and do mountain climbers. So like,
mountain climbers are terrible on sliders.
And then go into low plank and have your feet on there and slide back up, do rockers with them.
Yes, slide.
Right, hang on. So sorry, where are the paper plates?
Put them on your feet.
On your feet.
You put your feet on the paper plates, and then you use them to slide your feet out.
Yes.
And it's
Gotcha.
Next level difficult.
And then you can put them on your hands too. And you could be in high plank. You can do wax ons and wax offs like that. Oh, and then you can slide them out for push-ups and back up. Oh, that's some next level shit right there.
Okay, let's wrap this up because
we got to wrap up. We got to wrap up.
Adam, thank you so much for your time. That was very entertaining, and we are going to have to do it again.
Absolutely.
There's a lot of wisdom there, and we'll catch up with you again soon. Have a lovely day.
God, thank you so much for having me on, guys.
Shish kebabs. My chair just fell over.